And in my subsequent slides, when we speak about the droplet infections and the airborne infections, we will also discuss about the engineering control there and their importance. So, if the infection control in system in healthcare facility, if you see, this is a very good slide where you can see on the top the standard precautions, which we have discussed in the previous module. But if you have a clinical scenario or the patient in the hospital where you need to take an extra precautions, where you think that simply taking standard precautions is not enough to curtail the infection in the hospital or to prevent the infection from getting spread, then you need to follow the other precautions, transmission based precautions. Whenever I tell that this is a transmission based precautions, it means the airborne infections, it means the infection which get transmitted through contact, it means the infection which gets transmitted through droplet. So, this is the basically the transmission based precautions are of three types, where you have an airborne transmission, contact transmission and droplet transmission. Criteria for assigning transmission based precautions, if you see here, category is assigned if there was a strong evidence for person to person transmission. Suppose if I have a case with an open case of tuberculosis or influenza H1N1 positive case where there are high chances of infection getting transferred from one patient to another, then you have to implement transmission based precautions. And the second point, if you see here, category assignment reflects predominant mode of transmission. That is where the importance is. That is why the infection preventionist should know the basics of infection control, epidemiology of the infection control, where you are going to see the modes of transmission, and based on the modes of transmission you are going to plan your transmission based precautions and preventions in implementations. Third point, if you see, if there is no evidence of person to person transmission via major routes, then use only standard precautions. See, this are the very good slide again, where many hospitals, because of the lack of awareness, we often see the patient needs contact precaution, they put in airborne, patient needs droplet, they put in contact. Such type of things happens because they do not understand the routes of transmission and the epidemiology of the infection. So, if you could able to understand which disease spreads and what is the route of the spread, then you can implement accordingly whatever the prevention implementation is required in the hospital. The last point, if there is a low risk for person to person transmission and no evidence of healthcare associated transmission, then use only standard precaution. This is what this slide tells about. You have to assign the category. When the patient comes to your hospital, you have to first define what type of infection he is suffering from, what are the routes of transmission, how it could be transmitted to the healthcare worker or the surroundings. And the third important thing, whether you are dealing with the host or the patient, is it immunocompromised or immunocompetent. Based on these findings, you are going to again classify your precautions, whether the patient needs a standard precautions alone, or the patient needs an airborne precaution, or the patient needs a droplet or a contact precautions.